Welcome into Eye.Talk.Tech, where we explore the intersection of eye care and technology. I'm your host, Dr. Griffin Christenson, and today we're honored to spotlight the legacy of Professor Brian Holden. He was a global force for vision innovation, and the continued work in general of Optometry Giving Sight is something we want to highlight today. And joining us here to help us do that is Dr. J.C. Aragón, U.S. Board Chair for Optometry Giving Sight, and also a close colleague of the late, great Dr. Holden. So first off, Brian, how are you doing? Excuse me, JC, how are you doing today?
I am doing well. How are you, Griffin? Thanks for the opportunity. Looking forward to the conversation.
Yeah, I've really enjoyed just having the opportunity to learn a little bit more about Dr. Holden, and I'm excited to flesh that out further today and hear more about what you guys are doing at OGS. First off, a word that came up and it was fitting for Dr. Holden was visionary. And I'm just kind of curious your perspective to, maybe lay the groundwork for our listeners here. In what way would you describe Dr. Holden as a visionary, and what was kind of the origin of Optometry Giving Sight here, if you could elaborate on those fronts?
Yeah, Brian was definitely a visionary individual on two fronts primarily. First of all, as a contact lens researcher, inventor, to a large extent, we owe today the fact that we have silicon hydrogel materials for contact lenses to Brian and his team's contributions back in the 1990s, working with many other groups, but he was the visionary individual behind what today is, the vast majority of the contact lens materials that we utilize.
Wow.
And as a humanitarian, Brian, Australian born, was always very much aware of the desperate needs that we had around the world as a result of the absence of sustainable primary eye care, primary vision care, which led to the establishment over 20 years ago now of Optometry Giving Sight in partnership with multiple organizations. But Brian was the spiritual leader. He was the first one that really put the importance of addressing uncorrected refractive error in front of health authorities, political authorities, World Health Organization, International Agency for the Prevention of Blindness, and even optometry. Our profession of optometry was elevated to a large extent by the visionary elements that defined Brian until his passing 10 years ago.
Yeah. Wow. Well, yeah, from the impact globally is obviously incredible there. But on a personal level, where did you cross paths with Dr. Holden, and what did maybe you learn from him personally, professionally, and how does this impact OGS today, would you say?
Yeah, well, I met Brian back in, a long time ago, probably 1986, 1987. I was working with Bausch and Lomb back then. And in Rochester, New York, Brian came to visit. Brian had multiple projects with Bausch and Lomb, research and development on one side, but also in the educational side. Brian was the not the founder, but he really took IACL, the international agency, the IACL Contact Lens Educators, International Association of Contact Lens Educators, which Brian led for many years, and I was very involved with that. Contact lens education around the world, China, India, Latin America, Africa. So that's how I met Brian, 86, 87, many years ago. And we were very different, in many ways. Brian was a huge individual, both physically and also his personality. And you felt when he entered the room. But we established a close relationship over the years, worked together on multiple projects, had the opportunity of traveling with him. Remember, we went together to the Summer Olympics in Barcelona back in 1992. That was a great experience with Brian. And I was involved with the birth of Optometry Giving Sight back in 2003. On a personal basis, I was no longer at Bausch and Lomb. I was working with Cooper Vision back then, and got Cooper Vision involved with Optometry Giving Sight. Cooper Vision has been OGS's largest donor for many, many years right now. SIBA Vision, now Alcon, was one of the founding partners of Optometry Giving Sight, so recognition also to SIBA Vision, now Alcon. And Brian, when Brian decided he was going to step down as chair of the global board of directors of Optometry Giving Sight, he invited me to take over. Not an easy thing to do. This was back in 2013, 2 years before Brian unfortunately passed away. So I've been, chair of the board, first the global board, and now the U.S. board, going back now 12 years. So it's been a great experience, continuing with Brian's legacy, and as committed as ever to supporting the international development of optometry, which is what we do at Optometry Giving Sight.
Yeah. Now I know you've had some involvement as it pertains to myopia management and that sort of a front. Is that something where you guys had quite a bit of overlap as well?
I remember the first time I heard anything about the ability to slow down the progression of myopia was in Sydney, having a meal with Brian. He took out a paper napkin, a pen, and drew for me the mechanism of action of how, through optical intervention, we could slow down the progression of myopia. This was some of the initial work that was done with Earl Smith out of Houston. And I should have kept that napkin. I should have framed it somewhere. So yeah, this goes back, I don't know, 20 years, maybe 15, 17 years, something like that.
Wow.
So the initial birth of what we know today as myopia management, Brian had a very active role bringing people together. That was Brian's strength, making people come together, people that maybe did not like each other. OGS was established through a partnership between the Brian Holden Vision Institute, the World Council of Optometry, and the International Agency for the Prevention of Blindness. Back then, the IAPB didn't like optometry, didn't work with optometry. We were ignored. They focused on ophthalmology and cataracts and trachoma, but not uncorrected refractive error. Brian changed that. But back to myopia management. Yeah, I've been involved with myopia management at Cooper being the pioneer in this space with the birth of MySight. And I was running the Asia Pacific business for Cooper when we launched MySight years before it received FDA approval here in the U.S. So, but Brian, another touch point with Brian, education, research, IACL, of course, Optometry Giving Sight, but also, the growth of myopia, our understanding of pediatric myopia, and what needs to be done to slow down the growth of the pandemic. And all of this comes together. Optometry Giving Sight, to a large extent, although we focus on the developing world, myopia, the myopia epidemic is not exclusive to the developed world. It happens everywhere, including the developing world. And that's where OGS is very much focused on.
Well, I suppose I personally owe you some sort of a nod of appreciation. And Dr. Holden, I was fortunate to be a CRT lens wearer growing up, and I'm doing the podcast without the aid of any correction, and it ended up about a -1, and it was a good deal for me personally.
Well, CRT, that was the Paragon Ortho-K product.
Yeah.
I ran that business, so I'm very familiar with the Ortho-K products and how good they are. And congratulations, good to hear.
It was a big deal for me.
Example of how we could correct vision. We could also not only improve vision but correct vision with myopia management.
Absolutely. The other area where I have, kind of a personal connection here to really the mission of OGS and so forth is I mean, the global impact you guys have had, we'll get into some of the numbers and so forth, is really, really incredible. But kind of the ethos of some of these optometric-based mission trips and that sort of a thing, I was fortunate enough to take a trip to Senegal as a student, and my dad's an optometrist. He gets a nod of appreciation too. He's the one that put me in the CRT lenses. But he was able to, kind of chaperone us with Dr. Craig Bowen from Pacific when we went on a mission trip. And so it was really impactful just seeing, how you guys have gone from, maybe beyond the mission trip model to building permanent tech-enabled eye care, on an international level. And, is that something that was kind of central to Dr. Holden's vision too? And what's been the process of building that up?
Obviously missions are necessary, but the need for mission trips is a reflection of how much we have failed to address the problem from a long-term sustainable perspective. Brian's vision was, again, the international development of optometry, where in countries where optometry did not exist, what could we do to establish optometry through educational initiatives, the establishment of optometry schools, the development of the human resource locally, and not having to depend on optometrists from the developing world to travel to Senegal or Nicaragua or name the country anywhere in the world to provide immediate aid, but without fixing the long-term problem. So, I'm an optometrist. I went to optometry school in Mexico, and I remember also every year going on multiple mission trips in Mexico and going back every year, and no progress was made. Very frustrating. Back then there was 2 optometry schools in Mexico. Now there's 14 optometry schools in Mexico. So now, we're teaching people how to fish and not simply providing them with the fish. So that was the overall philosophy behind Optometry Giving Sight. Takes time, takes money, takes patience, but we're making progress. Once we decide, okay, there's the need for an optometry school in a specific country, it takes about 10 years before that optometry school is actually graduating optometrists. So it is a long-term investment. Not every donor is patient enough. As you know, Americans are very impatient. They want everything now. They want everything to go into the microwave and for it to taste as well as a Michelin 3-star restaurant. Optometry school development takes time. And fortunately, we do have some data that has indicated that our long-term commitment to the international development of optometry is starting to pay back. We've had some failures. We talk about Haiti, where everything that could have gone wrong went wrong, but we're still there. We're patient. We're committed. And other countries where things have progressed much more smoothly. But in any case, it takes money and it takes time.
Yeah. Well, we're excited. The next episode after this one, Dr. Aragón's going to be with Dr. Purcell from NECO, talking a little bit about some of.
Very well.
Yeah, talking about some of the technological innovations they've implemented in education and schooling and so forth with the big program they launched for digital learning in 2021. But is digital learning been a big part of what you guys have done internationally?
It has, and it's becoming more and more of a useful tool. Like, obviously COVID changed everything. And Haiti, and we have an optometry school in Haiti. And obviously one of the biggest challenges that we have in developing an optometry school is faculty development. You can't teach unless you have faculty. Based on the political unrest in Haiti, the dangers of traveling to Haiti, of course there was a huge earthquake a few years ago in Haiti, and of course COVID. So suddenly we could no longer send, visiting faculty to Haiti. Back then, the optometry school in Haiti was being supported by the Brian Holden Foundation out of Sydney. very far away, linguistic barriers. So although Brian Holden Foundation still supports us in Haiti, we established an agreement with the optometry school in Montreal, Canada. They're closer, they speak the same language. So now, with the help of Montreal, we are teaching students in Haiti using digital tools. And if not, we could not be teaching because we cannot send faculty to Haiti anymore, at least not now. Nothing replaces face-to-face education, believe me. Well, I strongly support face-to-face, but it's expensive, and in some cases, such as Haiti, we simply cannot do it. So we have deployed a lot of digital tools now for teaching optometry students in Haiti. This is driven by Professor Luigi Bilotto from Montreal in Canada, working quite well. And it is what we have right now. And we use similar tools in other parts of the world, but Haiti probably is the most visible example of what we're doing currently.
Sure. And, you mentioned and alluded to the uncorrected refractive error crisis and how important that was to Brian. And, is there a ability to leverage technology in combating that in particular as well, would you say? Or what's the connection there between his forward thinking and the way that we can leverage technology today?
Well, yeah, of course, teleoptometry now is a big thing, right? We've come a long way. Artificial intelligence as a tool. If we marry all these technologies, I'm not a technical wizard, far from it. I'm too old for that, but I understand what's going on.
Yeah.
And of course, as we need to reach remote parts of the world, but even remote parts of the developed world, even in the U.S., right? Not everyone has access to an optometrist, and the U.S. has, 45,000 practicing optometrists, more or less. There are countries in the world that you can count the optometrists by the fingers in one of your hands. So being able to use, teleoptometry technology to diagnose and treat uncorrected refractive errors would be vital. The number one cause of vision disability is uncorrected refractive errors. And if people can't see, they can't study. If they can't study, they can't get a job. It's very simple. And even near vision, readers, something so simple as a pair of reading glasses prevents people from getting a job or going to school. So we can't reach the entire world physically, so we must deploy technology in order to support the other efforts that we have in place. And again, what we're doing between Montreal and Haiti is a good example of that, but I think it needs to go beyond that. There needs to be a cultural change. I think still the profession of optometry is very concerned about using remote tools. The concern about what's going to happen to my job, what's going to happen to my profession, what does it mean for me? But I think gradually we'll get there. And again, the world is quite big, and not, I think the U.S. has, with 5% of the world's population, I think the U.S. has about 30% of the world's optometrists.
Sure.
But in the rest of the world, there's a huge need for these type of tools.
Yeah. Well, and just to give you my perspective and maybe personal bias, but focus on taking care of patients first, and the rest will come. And yeah, maybe there's some challenges technologically for what it means for, a lot of different career paths and professions and so forth. But if we're helping people, and at the end of the day, I think maybe sometimes we underappreciate what a gift and a blessing it is to provide clear sight. Sometimes that becomes mundane almost for the U.S. optometrist, and just that corrective treatment that we're able to provide is a big deal. You can imagine, as you highlighted there, the difficulties people have when they don't have that.
We are very fortunate as a developed country that it's not a representation of the world.
Sure.
And that what we've done at OGS and reaching out and establishing optometry schools, we also support missions. Don't get me wrong, but that's not our DNA. Our
Yep.
DNA is the sustainable development of optometry in the developing world.
Yep.
And that's why we exist. That's what makes us unique. We don't run our own programs. We raise funds and we allocate those funds to different initiatives that share our philosophy, share our vision of establishing and growing optometry where it does not exist.
Yep, and I think your fishing model is an apt one there for sure. And what's been instrumental to you guys being able to create these self-perpetuating systems? Look at some of the numbers here that I have, and I think this changed even from when we were discussing outlining the podcast here. JC, what I have in front of me is 14 optometry schools launched, 200 plus vision centers developed, 14,000 professionals trained, and 15 million people reached. But that number is going up by the day. How have you been able to sustain that?
Well, because we raise funds. So we work with multiple partners. And our ability to expand these very impressive figures depends on our ability to partner with organizations that share our visions, share our philosophy. I mentioned, Montreal as a partner. We have multiple partners around the world. That's their expertise. Berkeley and Brian Holden Foundation. And so we work with organizations that focus on that. I had an opportunity of visiting Vietnam less than a year ago. And Vietnam, a country of 100 million people, growing economy. Of course, East Asia, Southeast Asia, where the prevalence of myopia is extremely high. And we've established, in partnership with others, not just ourselves, these are partnerships. No one can do it on their own. There's 2 optometry schools now in Vietnam. One in Ho Chi Minh City and one in Hanoi. And a few years ago there was nothing. And these 2 optometry schools, and I had a chance to visit one of them, the one in Ho Chi Minh City. It's an impressive facility, and there's a vision center attached to it, not just educating but providing primary eye care. There's a pediatric myopia clinic that funded by Mr. Bob Weiss, who a great gentleman who was the CEO of Cooper Vision, now is the chair of the Cooper Company's board of directors. Huge heart, and he's funded this pediatric vision clinic in Vietnam with his own money. So again, we bring people together. That is our objective. So anyone that is listening to this that has money that they want to invest in the international development of optometry, just visit us. Givingsight.org. That's what we do, and we don't use the money. We allocate the money to the organizations that have that expertise to open optometry schools or improve optometry schools or establish these vision centers in the developing world.
Well, and to commemorate, as you mentioned, the 10 years since Professor Holden's passing, you're launching a tribute event here, correct, JC? We have the Brian Holden Founders Award Dinner. And what is this night going to represent for OGS and just in general?
Yeah, it's tough. Brian, he was a very close friend of mine, so I miss him every day. He a challenging individual. He made you think, which is not always good. But he challenged everything, and he was big, big in every way, in every sense of the word. And so, Brian is missed, and so we've decided to, with the support of Brian's widow, with Yvonne Holden and the family, Optometry Giving Sight has established the Founders Award, the Optometry Giving Sight Brian Holden Founders Award, which we will be issuing on October 7th in Boston, the day before the American Academy of Optometry meeting starts. And we're recognizing an individual, Dr. Greg Pearl, who practices in Southern California. Greg has been involved with VOSH for many years, but also on his own. He was very active in the establishment of the optometry school in Nicaragua. and Optometry Giving Sight gave a grant to purchase the equipment for the clinics. But Greg also had or still has a vision clinic in Nicaragua where he goes and he provides vision care services for the needy. So again, education, long-term investment, but also providing vision care for those that need it right now. So Greg is being recognized, Dr. Greg Pearl, great gentleman, humanitarian. But we're also recognizing Cooper Vision. Cooper Vision, again, they've been the biggest supporter of Optometry Giving Sight for 15 years. Who knows how many millions of dollars. So Jerry Warner, the president of Cooper Vision, will be joining us, and we will be recognizing the support that we have been receiving from Cooper Vision for all these years. Not just money. Money is the easiest thing to do. It's the involvement of Cooper Vision's employees, Cooper Vision's customers, even the wearers of Cooper Vision contact lenses have a chance of donating the rebate to Optometry Giving Sight. So it's a vertical integration of Cooper Vision as a company, their employees, the optometrists that do business with Cooper Vision, and even the patients of these optometrists. All of them over the years have been donating money to Optometry Giving Sight. So this is a form for us to thank Cooper Vision, thank Greg Pearl, and we plan to do this every year. A recognition to an individual, and then a recognition to an organization.
Sure. Well, and one more time, I know you mentioned, and we'll put it in the show notes here too, but for those who do want to contribute or, maybe go above and beyond that, and for those who are attending the AAO meeting in Boston, where can those folks go for tickets and so forth as well?
Again, www.givingsight.org. I'll repeat that, www.givingsight.org. That will give you the necessary links. We're starting the World Sight Day activities also. As you know, the first Thursday of October, we celebrate the World Sight Day. So we've started the World Sight Day Challenge, which we've been doing now for about 15 years. So there's many ways that you could donate to Optometry Giving Sight. And, I would greatly appreciate it. Our board and our management team will greatly appreciate it. But more than anyone else, those in the developing world that receive our funds will be very thankful. So again, www.givingsight.org is our website.
Wonderful. Well, Dr. Aragón, thank you for all you're doing, for the international community here, for just the mission of OGS that's blending so many different things here and allowing us to talk about the way that you're leveraging technology to do it all. And I just really appreciate your time.
No, thank you, and good luck with this new initiative. Fantastic, and congratulations to you also. And thanks for the opportunity. Anytime we can reach out to the world of optometry, we want to do it because we consider ourselves as the optometrist international charity of choice. So if you want to help the global expansion of optometry, that's what we do. So come and visit us. But thanks, Griffin, for the opportunity, and very nice to meet you.
Absolutely. Likewise. And for those, enjoying the show and want to hear more about the ways that optometry is impacting the world, hear more about technology in optometry and eye care in general, give us a like and subscribe. Like I said, next time we'll be back with Dr. Howard Purcell. So look forward to that one. And I hope you have a great one, Dr. Aragón. Pleasure meeting you. Take care.
And you. Thanks a lot.